Well, welcome. We are here on the day before Thanksgiving. And so what I thought I would do today is tell you what I'm going to cook up in case you start not feeling well. So I'm going to call this up Thanksgiving wellness cooking, something like that. Anyway, this is Tustin Longevity. I'm Dr. Ella Thorpe, and this is our weekly Ask the Integrative Doctor Any Question. Again, type in your questions, any question that you want, and I'll do my best to answer it. In general, we're trying to give general information about the integrative approach we here at Tustin Longevity will do. So since it's raining here in California, and we thank the Lord for the rain, we are just getting the nice holiday spirits and getting inside by the fireplace and all the cooking that's going to take place. And I thought today it'd be nice to tell you, if people are calling in and saying, I feel like I'm coming down with this, or I feel anxious or nervous about being around relatives, what can you recommend outside of drug therapy? So I'm going to start with, if you, I had a patient just yesterday come in and say, I feel like I'm coming down with the flu. And she was getting the chills, and she was getting then the feeling warm and the low backache, and then some of the runny nose. And so one of the first things we talk about is taking a high dose vitamin D. And I've talked about this before for cold management. These are vitamin D 50,000, 50,000 international units. And you'll see they're in a row of 5, and it's to take 1 a day for 5 days. 1 a day for 5 days. You don't take them every day, but as soon as you think you're coming down with something, you can build up your lymphocyte, your virus-fighting immune side of your blood white cells count, and you can build it up with the high-dose vitamin D for just 5 days. 1 a day for 5 days. That's the first thing I would tell anyone who's coming down with the flu. I also tell people, if you're taking a flight and you're going to be on a plane for several hours or a couple of hours and the air is circulated, I take 1 before I get on any airplane. So that's one thing I would suggest doing. The other thing is I recommend taking high-dose vitamin C. Now, we have Vitality C, and this is 4 grams of vitamin C per little scoop in water. So I would just mix it in my glass of water here. And I would take this also, especially if I'm getting on a plane ride, to boost my immune system. You can take a scoop of the 4 grams up to 4 times a day. But when you take vitamin C orally, it tends to make your bowels loose. So it's good for those of you who are constipated over the holidays. If you took something like this 4 times a day, you'll probably have your bowels move for you. So vitamin C is very good for the immune system. Remember, human beings don't make any vitamin C. We make none. Animals make lots of it, especially if they're injured or ill. And so vitamin C is another thing to have around the house. So I have all these things in my house at this time. If any one of my family members come down, I start pulling out my little concoctions I'm going to go over. The other thing is, very often, if you are constipated or if you're anxious, I give the the mineral chelate, which is called OptiMag Neuro. OptiMag Neuro is a powder, and I'll often put it in my water at the same time I'm putting in my vitamin C. And I often take this just myself for health every night. I'll mix my vitamin C with my magnesium amino acid chelate. And this also has threonine in it. And so it is very relaxing and calming. You could do this a couple of times a day. I also give it to people who have muscle cramps, and I give it to people who have insomnia to relax them. I give it to people who are anxious, and it helps with bowel movements. So this is a very nice combination if what you eat gives you constipation. But if you're getting a cold, you can use the vitamin C with the vitamin D high dose 1 a day for 5 days. Now, we have drugs. There are drugs like Tamiflu for the flu, but something you might do, and there is research on herbal treatments in competition with a population of patients who are on the drug Tamiflu. And we found that these herbs are very good at fighting the flu, influenza flu. And this Viricid has vitamin A in it, which is very good for all the membranes that are exposed to the virus. It's got some vitamin C in it, vitamin B12, zinc, which is very important for the immune system. But the herbs that are well studied are astragalus, European elderberry, andrographis, echinacea, L-lysine, and acerola extract. So I use 6 of these the first day of any bad flu I might be coming down with, and then I use 2 a day thereafter. And so Viricid is another wonderful herbal safe thing you can do if you're coming down with the flu. So I keep these in my home in case any family member is starting to become ill. All the while, if any of you have symptoms and you're getting seriously ill and not improving within a day or 2, of course, go to your urgent care, ER, or your local doctor. Now, it's stressful very often during the holidays. And as I already mentioned, magnesium is very relaxing as a drink to put it in your water. But I would take, and I am now taking for the holidays until we get through January, I have upped my vitamin B methylated B complex to cover that methyl tetrahydrofolate genetic SNP many of us have, maybe 30% of the population. So I'm taking extra B vitamins for the stress of the holiday seasons. So that's something to consider for anxiety. Another thing is we have put together what is called TLC Calm. This is an herbal alternative to going to drug therapy for anxiety. We put in here passion flower, GABA, 5-hydroxytryptophan, valerian root, extra magnesium, and L-theanine. These are all things that have been studied in comparison to drug therapies that are very calming for the anxious person. Another item that we have found very helpful that has other herbal contents in it is Adrena Vive. Adrena Vive for anxiety over the holidays has in it ashwagandha, a herb that's been very well studied in anxiety disorders, but it has skullcap, erythro root, rhodiola, L-theanine, and phosphatidylserine. So that's very, very good. Now, since there's going to be a lot of eating probably over the holidays, you might want to prep yourself, by the way, with something that satiates you or depresses your appetite so you're not out of control. So I'm going to tell you, we've done the studies on the bar. We created 15 grams of protein, 15 grams of fiber, soluble and insoluble, to help with the bowel movements, helps with the repair of the cell membranes. Remember, whether you're getting a cold or anything, you're getting a virus injuring your cell membrane, and it's made of all these phospholipids. If you're getting injury to your gut lining, you need those phospholipids. So this is full of it. But we also tested it for satiation. It calms your appetite down. So for those of you, this might be a very good option to take before you go to try and stuff yourself with a big, big meal. Another thing is, if you're going to eat that large meal, you might help your digestion with a digestive aid. Orthodigestium has served us very, very well over the decades. If you're blood type A, definitely you need to be using this with all your meals. But those of us who are 50 and older, our digestion diminishes, our capacity to digest food. So anyone 50 or older, no matter what your blood type, it might be a good thing to take some digestive enzyme with your turkey dinner or this large meal you're going to consume. So that's another good suggestion for the holidays. If your throat is starting to feel part of your flu syndrome, a raw throat, the lady I saw yesterday had that, I have told her to use Hydrosol Silver. Hydrosol Silver, this is called Argentine silver, is nanoparticulate. Colloidal silver is more clumpy particulate. It is a good product. You can get it over the counter, but we have nano, which is far, far smaller and a more uniform distribution of the silver, which is very bactericidal, kills bacteria, virucidal, kills viruses, and it's fungicidal. And so, you know, a spray many, many times. If I burn myself while I'm cooking, I'll spray the area with this as well. And so Argentin is a silver, which is a known antibacterial, antiviral, antifungal. Also, if you're tending to get sinus congestion, you might use the nasal form of it and use this up your nose multiple times. This is quite safe. You could actually drink this and it would be just fine. It's safe for everyone. There's no side effects. Now, another thing is there are people that have food sensitivities, and you might be tempted to be eating something that you would not normally eat. Well, there's a couple of options. One is if you don't have bad heartburn or indigestion, then maybe a simple scoop of L-glutamine. L-glutamine is an amino acid that helps this lining repair as well, the proteins in the lining of all your cell membranes. This is our antacid in our household. I use L-glutamine whenever I start feeling indigestion or heartburn. I'll take a scoop, put it in some water, drink it down. I might do it 2 or 3 times, 5 times. You can take as much as you like of this. This also has the vitamin A and some zinc in it, and N-acetyl D-glucosamine, deglycerized licorice root extract, aloe vera, but it's primarily L-glutamine. So this is a very simple and easy antacid that you can take. The other thing is, if you have a very sensitive, irritable bowel tending toward ulcerative colitis and Crohn's, another thing you might do is prep yourself. The day before you eat, the day of eating something that you are having trouble digesting or you're sensitive to. This is phospholipids. These are the very fats that are in this bar that are in the lining of every cell membrane in your human body. And so mixing a scoop of this with a scoop of SBI Protect. These are immunoglobulins that help protect your body from inflammation, infection, and such. Mixing these 2 things together in some water is a good mixture so that you're not having as much damage to your gut if you think you're going to be eating something that you shouldn't be. If you really have sensitivities, you might add a packet. These are packets of probiotic powder, and you can mix all 3 of these things together, the probiotic, the phospholipids, and the SBI Protect immunoglobulins, and take it as a drink before a meal that you might be concerned that there'd be some food sensitivities. This helps the lining of your gastrointestinal system. So we have used these traditionally here for many decades, and we have found them always to be helpful, even with our very serious ulcerative colitis patients. The last thing is, if you're getting congestion from a cold, inflammation, and cell damage, you'll want to take on an empty stomach enzymes. Enzymes help stop the inflammation, the achiness of the back pain, the sinus pain, pressure. This helps disinflame your whole body. So taking 3, 5, 6 of these on an empty stomach twice a day, 3, 5, 6 of these, they're basically equal products. This is less expensive, so this is more often what's chosen. But these help reduce the inflammation in your body. So I think I've covered it all. And you might want to remember we have the IVs in the IV suite, high dose vitamin C and immune drip to boost yourself up. And you don't have to be a patient here. We can take walk-ins. You can make a gift certificate for a loved one, the gift of health, so they could get an IV or some nutrient. So I want to ask now if we have any questions.
We don't have any questions, but I would love to ask one.
Yes, go ahead.
I personally had a lot of back pain, and I started taking Vascuzyme with TLC Deflame.
Yes.
And it has helped a lot. If you want to maybe talk about TLC Deflame a little bit.
Yes, TLC Deflame, I don't have it up here. TLC Deflame contains in it items that are known anti-inflammatory, primarily the turmeric curcumin That's that herb, Indian herb, that is a powerful blocker of the inflammation pathway cascade. It's an anti-inflammatory. It is a capsule. So we have TLC Deflame. We also carry Dr. Perlmutter's NRF2 factor. NRF2 is a curcumin, turmeric, very similar product. So that, along with enzymes, is a double whammy to stop the backache, to stop the knee pain, sinus inflammation, those things as well. And then, of course, you don't want to forget your water. There is nothing that is going to be carried out, debris, damaged, virus, waste material, unless you drink enough water. So I think I've covered our approach to little home remedies that you can do if you feel you're coming down with something over the holiday weekend or the Christmas season. So refer to this video for good steps, simple mechanisms for helping you with treating things at home, saving your time and effort to have to go to a doctor. Again, if things worsen or you're not improving in 24 to 48 hours, then you'll have to consult a physician. But I think that covers it. Any other questions?
That'll do it.
Well, we at TLC want to wish everyone a very blessed Thanksgiving time as we meet together with our loved ones and friends and family. And so I pray that you enjoy that meal. It's the one meal I'll never tell my patients, watch your carbs, because it is a time of rejoicing. But maybe consider the following day doing your fast, practicing fasting in your life. And we refer you to Dr. Jason Fung's, F-U-N-G's videos to look at the various forms of fasting you can employ. I certainly will be fasting the next day after Thanksgiving. And with that, I wish you a happy Thanksgiving from all of us here at Tustin Longevity Center. Thanks.
Perfect.